Welcome back, my good people, and in today's video we are going to discuss about early signs and symptoms of HIV. And if you have not subscribed to this particular channel, kindly hit the notification bell, written subscribe, turn it on for more videos that will, and also do not forget to press the like button. Kindly share the video and put some comment down there about this video, because it will help us to modify and to rectify where we've gone wrong in all this our medical video. How can you know that your man has HIV? So the basic thing that we should be able to 3 stages of HIV. Now the primary stage, or the acute stage, or what we call seroconversion stage, is the most important stage that we should be able to know. This is a stage that there is a huge multiplication of the virus, and this is the stage that the body is trying to defend itself. That is the body response to the virus in immune system. And this particular place and this particular time is where the virus normally multiply very rapidly, and this is where they attack the CD4 cells, and this is a stage that we say that it's an infectious state, that the spread of the virus can be so rapid, particularly if you look at the mode of transmission of HIV, mentioning sexual intercourse, sharing needles, and even unscreened blood transfusion, or even needle stick injury for those who normally work in medical. So this is that stage that classically you will really transmit this particular virus, and this is a stage that it is important to start HIV drug, that is antiretroviral drugs, as soon as you have been tested and you have been confirmed positive. The signs I'm going to talk about are cutting across very many diseases, other viral infection rather than HIV. Other bacterial infections are also can mimic this particular presentation. Even fungal infections can mimic this particular presentation. So it's not a thumb of rule that whatever I'm going to discuss is only related to HIV, but it is a pointing sign towards early infection, early seroconversion period of HIV. But the most important thing is HIV testing and counseling. So if you verify, or if you see these particular symptoms or the signs in your body, do not peg it to HIV. Go for HIV testing and counseling. Make sure that you are tested and confirmed that you have this particular virus before you think of that you have HIV infection. Now, fever will form 80% of your signs, in that you will develop this particular fever because of the immune system. The body is trying to defend itself. So when you take your temperature, the temperature might be around 37 going to 39 degrees centigrade, and sometimes people may rush and take some antipyretics like brufen, even paracetamol, just to relieve this particular. You will tend to get tired. You will develop what we call general body tiredness or general body malaise. You can't even do your duties because the virus is multiplying very fast and interfering with your immune system. So the body will be responding. Muscle pain or general body pain will be very obvious, and this by mimic other diseases like malaria, even typhoid. So I would say that you must be tested for HIV just to rule out this. So you will develop the muscle ache, muscle pain, and this might even lead you to start going to the hospital because you do not know what is happening to. Again, when the body is responding, the immune system is being reduced because of the virus. Your skin will start reacting, and you will develop rashes all over the body, and this is this can be verified case by case in different types of patients. because it's not a general rule of thumb that you might develop this rash if you have HIV. Sometimes you might not develop rash, but rashes are one of the signs of you should be able to know, because the body will be responding. The headache will be there. Sometimes you will have frontal headache that comes and goes, despite the fact that you are taking even paracetamol and brufen, and this will be accompanied by sore throat and even nasal congestion because of the virus that is now multiplying in your. Important thing is that you will be able to note that your lymph nodes are also enlarging. They are also swollen. They are also, if you touch your throat, there are several lymph nodes in your body. There are some which are here, there are some which are here, there are some which are here. You will notice that even the inguinal ones, you notice that you will develop what we call lymphadenopathy due to the viruses are now being transferred to the lymph nodes when the body is fighting the virus. So lymphadenopathy or swelling of the lymph nodes is a very, very number one sign in acute primary infection of HIV. So you should be able to take note of that. Latency stage, or what we call chronic infection stage, which can occur between 2 weeks to 10 years. 2 weeks to 10 years. It's very, very important to differentiate the latency stage with the primary infection. So primary infection can normally takes around 2 weeks to 4 weeks for it to regress. Now, from 2 weeks to around 10 years, this is now the latency stage, or clinical latency, or even what we call secondary infection. So there is something which is very, very important at this particular latency period, that we should be able to know that when you are in this particular stage, you are still infectious. You can still be able to spread this disease. You are able to transmit this disease, maybe particularly the sexual intercourse, all those modes of transmissions of HIV that we've not discussed here, but sexual intercourse is one of them. So you are highly infectious at this particular stage, and this is where now, if you detected or if you have tested that you have HIV, you should be able to use protection with your partner, and you should be able to reveal to your partner that you've been tested of HIV and you have been confirmed. Types of individuals that falls in this particular stage that I should be able to let you know, and these are called HIV controllers or long-term non-progressors. They have detected viral loads, but the level of CD4 are high even if they do not take antiretrovirals, and this can also progress to HIV/AIDS. So these HIV controller or long-term non-progressors can also infect individuals very, very fast unknowingly. And the other, which is so much dangerous, are the elite controllers. Elite controllers are what we call elite suppressors. What are they? They are people who have CD4 at the normal range. Their CD4, despite the fact that they have the HIV virus, but their CD4 are in a normal range, but their viral load also are low. They are LDL, non-detected levels. So these particular individuals are just okay, but they are transmitters. They can transmit HIV, they can spread it like fire. So the best thing to know after that seroconversion period, that you had those fevers, you have those headaches, you have the smaller body rashes, those sometimes they can disappear, but now you remain at the latent stage that you infect people unknowingly. But the best thing to know is to test yourself before it progresses to what we are going to discuss again, that is called the final stage, which we call acquired immune deficiency syndrome. Take note of HIV test, come to the hospital, get tested, so that we can be able to start managing you early enough. If you have not subscribed to this channel, hit the notification bell, subscribe for more videos that we post. And if you are interested to know how antiretroviral drugs look like, just check around this particular place and click that link. It will redirect you to a video on how HIV drugs look like, the antiretroviral drugs. Muchas gracias. See you in the next video.